Intentional simplicity leading to clarity of purpose, yielding the time and energy to live a happy and fulfilling life.
Welcome to Back to the Future podcast. My name is Victor Sadia, and I talk with brilliant minds and hearts of people who want to uproot and transform the current health and wellness paradigm. Good morning, good afternoon, good evening. Today we have Dr. Victor Peña-Araujo. Dr. Victor Peña-Araujo is a biologist from Hamilton College and a pediatric surgeon from the Royal College of Surgeons in Ireland. Dr. Peña-Araujo was one of the first doctors in the world to be certified in lifestyle medicine by the International Board of Lifestyle Medicine, and is the founder of Elite Personalized Health. Thank you very much for being with us today.
Thank you very much for having me, Victor. It's a real pleasure to be with you today.
Thank you, Victor. So why don't you start by telling us, why did you decide to study medicine?
Well, my father is a pediatric surgeon, and I grew up in Mexico City. So ever since I was about 5 years old, I wanted to be like him. My interest started out of admiration for my dad. And then I followed his career as I was growing up, and I remained interested. And so through the Boy Scouts, I was doing first aid, and I was interested in all these things. And then when it came time to apply for college, I reconsidered. I thought, okay, is there anything else I want to try other than medicine? Because this is a big decision. So I looked at architecture, engineering, and aviation. Like, I wanted to be a pilot. And I thought, no, I do want to commit to medicine. So, but in the United States, you have to do a college degree before medical school. So I went and did a biology degree, and I completed my pre-med requirements and a Latin American studies minor to prepare for medical school. So yeah, I had always wanted to do it. I had been a lifeguard. I had been an emergency medical technician. I just loved all of that. And it was always extremely rewarding for me to help others. Even as a child, I was like helping the neighbors, and whoever got hurt, I was there. And it was the thrill of helping people. So yeah, it was really an identity that I've always had and I've always enjoyed. And it's never worn thin. I've never gotten tired of it. When I move away from it, anytime I do anything that is not meaningful to the health and wellness of other people, things bore me. I just don't see much of the purpose, like making money for making money. It just doesn't make sense to me. So I really am locked into that principle of helping others because it's rewarding for me.
Tell us a bit about the first years of your clinical practice. How did those go?
Well, so I then went on to study medicine, as you mentioned, in Ireland. And that's a 6-year program. It's very similar to the programs that you see in Latin America and in other places in Europe, where it's a 6-year program instead of 4, as in the US. After those 6 years, I did my internship in Dublin, Ireland, and it was very, very intense. I had always known that it was going to be intense. My dad was warning me for years, you're not going to get a chance to go to the bathroom or to have lunch or to sleep. So I always knew I was prepared psychologically. And it was extremely intense, but enjoyable and fulfilling. After so many years of preparing and hoping to get to do this, I was in my element. So it was very, very intense and exciting. Trauma, the emergency room, the operating room, intensive care units, all that work was incredible, very rewarding.
And what happened at some point where you decided to, continue practicing the medicine that you had studied for, but at the same time started to looking more into wellness and lifestyle of your patients and yourself?
Well, so early on, in retrospect, everything becomes clear. But early on, I did my surgical and medical internship. Then I did my basic surgical training. And that was all with adults. And I always wanted to be a pediatric surgeon. So I kept thinking, this is just for me to hone my clinical skills, but I'm going to move on to pediatric surgery. And I did move on to it. So I did 5 years of adult medicine and surgery, and then 5 years of pediatric surgery. And pediatric surgery, I enjoyed thoroughly. I loved it. It was everything that I imagined it to be. But what's interesting that I did not expect is that my previous 5 years in adult surgery, just several things stayed with me. And it was just this lingering thought that there was something wrong with what we had been doing. It was an approach of, I rotated through, gastrointestinal and bypass cardiovascular, urology, all kinds of subspecialties. And I had really gotten to see a broad presentation of what ails adults. And what ails adults, what makes them sick, what gets them in the operating room enduring incredible operations like bypass surgeries, amputations, all kinds of things, tumor removal, all of this, the vast majority of these problems that were catastrophic to their lives and the quality of their lives had roots in their behavior, in the patient's behavior, and their choices, the lifestyle choices. And so they were chain smoking, they were drinking excessively, they were not exercising, they barely ate any vegetables, they were stressed out of their minds, they were chain smokers. All of these things, I just started noticing, when are we going to address that? And I remember distinctly, being 3, 4 in the morning in the emergency room, writing my notes, of all the patients I had seen, and just thinking and seeing all my colleagues around and thinking, there's so many busy, exhausted doctors like me here taking care of all these sick people that don't want to be here, but they've had to come in with heart attacks and strokes. Why can't there be a doctor like us, but taking care of them before they need care? Why can't there be somebody to educate them as to what to do? They never have to end up as these patients. I saw so much suffering. That's the thing that motivated me to end this suffering, what I see as unnecessary suffering. If they just make the right choices, they'd never have to be here to begin with.
Was it evident for you when you were receiving these patients in the ER that the outcomes they were having, the acute things that were happening at that point, were consequence of their lifestyle? Was that something that it was really, really conscious at that time?
Yeah, well, we do study that. So we don't study in medical school. When I went to medical school, we learned the pathophysiology of disease, the pathology, the origins of disease, etiology, what causes the problems. But we didn't learn it in an applied way, as in a way to prevent. So we learned it as, well, this is what happens. And so therefore they present to you, and then you say, I have a patient in room 2 with ischemia. Well, nobody says, well, ischemia, that's poor blood flow, let's say, to the leg. But why? Here it says that he's a smoker and he's a drinker, he has some liver problems. And so only when you start doing a full history and you find out that they don't exercise and you ask the right social and personal questions and what they like to eat and what kind of job they have, do you start noticing patterns? We were taught that was important stuff, right? But you just document it and you take it as a static clinical picture. Like, this is the guy with the ischemia because of this and because that's the diet that he has and he's the smoker. You never, especially as a surgeon in training, we never said, how do we get them to stop smoking? How do we get them active? And you never go back and reinvent that. You just deal with the consequences of all these things. That was the paradigm shift for me. Towards the end of my training in London, when I was doing my surgical fellowship, I read an article that introduced the concept of lifestyle medicine. And the penny clicked. I mean, I thought, yeah, they're doctors and they get to the beginning of the problem, the root cause. And as doctors, they prescribe the right lifestyle so that person never ends up in the emergency room under the surgeons like the way I used to be. And that was just a beautiful moment, an epiphany, a real epiphany for me. And I thought, I want to do that. I mean, the potential to reduce suffering is monumental. It's massive, right?
At that point, when you read about lifestyle medicine and you said to yourself, I want to do that, did you also picture it as leaving surgery?
Yeah, I could. Well, by then I had been in pediatric surgery for 5 years. So pediatric surgery is a completely different beast. Beautiful in its own right because you're treating problems that the children are born with. They have not done anything about it to deserve it or not deserve it, but just to... So that, I actually remember thinking, I'm happy that I'm in this specialty because they don't have those problems. They're inborn problems and the motivation is so pure, so perfect for that. But I was still kind of annoyed by a nagging annoyance at what I just described about adults. And so there are no surgeons in lifestyle medicine, so I'll move out of surgery. And that was a big decision for me during my fellowship, especially after, like I told you, that's all I had ever wanted to do for years. I could not believe that voluntarily I was going to try this. And the plan was to leave it for a year, look into this entire field and see what happened. If I missed surgery terribly, I would just go back to it in England. But it wasn't to be. I really enjoy what I found and I'm still here after almost 10 years. So what it was is it was a move to, I'm going to shift to another specialty. That was the original plan. I thought I'll move to the United States and I'll have to do a whole residency. I was thinking of maybe doing a physical medicine rehabilitation or one of those, or maybe family medicine. But then while I was preparing, all these things, I thought, but it's kind of silly to train for 3 years into a specialty that you don't want to do. Like, I don't want to be a family physician, that it was going to be some kind of compromise to then get to do lifestyle medicine. What's the essence of lifestyle medicine? And I really remember having this conversation in my mind. And I thought, well, I just want to sit across the table from somebody and help them improve their life. That is the essence of it. Do I care if they call me doctor or not, or if I'm in a clinic or a hospital? I chopped away gradually all the noise. And the purity of what I wanted to do was sit across the table from somebody and help them. That's when I started learning about coaching. I thought, that's exactly what I want to do. I don't want to prescribe medications. I love surgery. I don't intend to operate. I don't intend to need a medical license. So I do any of those things. And I was getting older. I had a young family, and I thought, I can't retrain all over again after 9 years of training. So I thought, let's just try this coaching thing. And once again, if it doesn't work, then I can always apply to a residency program and do it the long way. And I did the coaching, and that's what I've been doing since.
How did your family, your close relatives, your colleagues react to this sudden change?
So many thought I was totally insane. My in-laws, my wife's parents were just like, what? What do you mean? Like, he's a surgeon. What do you mean? And it's funny because I think more people got flabbergasted and confused about it than I ever did. To me, it just felt right. And to be honest with you, it's probably the craziest decision. If at a party you ask me, what's the craziest decision you've ever made? I'd say that's probably right up there, because I had nothing waiting for me at the other end. It was just a leap of faith. And I don't usually live my life that way. Everything's very calculated, very well thought out. But I think it's a sign that when you have that passion and you feel something feels right. And by the way, I'm not saying that it's a sign that everything's going to be okay. I'm saying it's a sign that it's the right thing to do. It could have been an absolute failure, but I would be at peace with myself, and I would say, okay, let's pack up again and go back to London and keep going with my surgical training or whatever. But you're at peace that you try that. It's kind of like when you're 18 and you want to be in a band and you want to be a rock star. You got to try it, right? Otherwise, you just kick yourself for the rest of your life. So I just had to try this. And so far, it's still working, and I'm thrilled with it.
I have been thinking a lot about the principles of coaching and medicine and how to really marry those. What has been your experience? Because sometimes we hear about the name coach, and for a doctor, that might seem like a lesser title. So how are the coaching principles really applied to medicine?
That's a great question, because to be honest with you, when I thought of all this, I thought, well, I've been interviewing patients for more than a decade. I know what I'm doing. I don't need teaching and coaching, but I had to get certified to get liability insurance. So I did several good courses in certifications in coaching, and I learned a lot. Where is this coming from? And to put in a few words, you basically go from being the expert that dispenses expertise and authoritative expertise, and you dispense literally prescriptions, but you also prescribe a lot of stuff, like not just medications, but you prescribe, you tell people what to do. And you go from that role of expert to this role of facilitator and guide. And it's a really different role. You may still know a lot. There's some coaches out there with PhDs and all kinds of expertise, but they keep it to themselves, right? The best coaches are kind of like imagine like a judo master. Like they don't even look like they're trying, and everything's happening around them. And that's the best kind of expertise in coaching. You are a facilitator. You don't need to be lecturing people at the time, and you don't wag your finger at them. You don't prescribe things. Now, that's just a clear cut. In real life, it gets a little blended, right? So they ask me medical questions, and I always clarify, look, I'm not your physician, so I'm not giving you medical advice, but we can have an educated conversation because of my background. I'm not going to pretend that I don't know. Most of the times I use my background as for cautionary tales or for discussion of consequences of poor actions, but I don't prescribe anything. So that was a big leap for me too. And so like how to speak to people, how to listen better. Now, I had medical communication courses and all that in medical school. So I knew how to interview, but it was to extract the information from them. I know you like wearing a lot of hats. So if you put on your coaching hat, you are trying to let them find the answer. So oftentimes they say in training, your client will believe a truth more if he says it to himself than if you say it to them. So if I say, listen, this habit of yours is going to kill you, that's kind of lecturing. But if we have a discussion in such a way that you get to that conclusion where you go, Victor, this habit, if I don't change it, it's going to kill me. That's it. I've done my job. I'm an expert. I'm awesome. And you don't even realize that I did anything, right? And so that's the difference. So it was really exciting for me. I love that learning curve. And so I said, wow, this is a whole new thing. It was very stimulating for me because I thought it was just a silly course for just to tick the box. But I really learned a lot and I'm hooked. I love it. And interestingly, looking back at my clinical career, I was always the slowest doctor in the clinics. We would have 46 patients to see in 3 hours just for myself. Everything would be pile up the work and my boss would rush me. And it was because I wanted to get to know my patients and solve these issues. So now I'm in my element. I just focus and go deep in my clients' situations.
Can you tell us a little bit about your training as a lifestyle medicine specialist with the American College of Lifestyle Medicine? And also if in their training they give you enough coaching skills, so that's something that you had to really learn out of experience and also the other courses you took.
Yeah. The way I did things in my own personal journey was I did the courses first. So I learned a lot of the techniques first, of the interviewing and coaching skills. Then I did the diploma. I would recommend it. I would, but I don't know what it's like to do it the other way. So I can tell you that by the time I took the exam for the diploma for the American College of Lifestyle Medicine, I was very familiar with, I would say, 90% of the material. Before I studied for it, I mean, like literally, I knew most of it. I just had to hone the numbers and statistics and things, but I was very familiar with it. So for me, it was relatively straightforward. So the coaching techniques I learned elsewhere. Now, they do test techniques, and I don't think it would have been enough to just study them from the materials that I got for the exam. In other words, a little bit of background in coaching really helps. If that's what you're interested in, by the way, because they do touch on some coaching and some interviewing and things. But diploma is for lifestyle medicine. It's for all kinds of people, from physicians to social workers and things. And by the way, there are 2 exams. I took the professionals exam, and then there's one for physicians, which has, I believe, about 30 more questions that are more clinical. So, I mean, I was taking it next to social workers and other people. So it's more of a communication heavy. My understanding is that it's more communication heavy and less of a clinical team sort of situation. I think ultimately for real coaching training, you need practice with people and you need feedback.
What lessons can we learn from you guys in the US, for Mexico and Latin American countries, where we want to build a new movement of lifestyle medicine, functional medicine, integrative medicine, all these new paradigms or not so new paradigms, but that are not really mainstream, and they should be?
Well, first of all, we have to be careful with the idea of mainstream and then, let's say, alternative, right? Especially in Latin America, there's a lot of alternative healthcare, a lot of alternative medicines, and I consider that kind of a bit of noise and distraction, which is very, very risky, very hazardous. What we need to do is, meaning people in the lifestyle medicine movement, is understand that this is scientific. It's just as scientifically valid as any conventional medicine. By the way, conventional medicine is not always scientifically valid. There's a lot of just by practice and because that's the way we've always done it, not because some kind of double-blind randomized control trial ever said that was the best way. But they're trying, right? They're trying, and we should keep trying. And so lifestyle medicine follows those scientific principles. So do not get grouped into all kinds of other hocus pocus, right? Do not because it sounds like a brand of medicine. It's not a brand of medicine. In fact, I always call it like a new medicine, but it is the oldest of medicines, the absolute oldest, right? Hippocrates would be proud to say, finally, food is your medicine. Like finally you guys came around to it. But so it's the oldest form of medicine, but it is evidence-based. It is scientifically sound. So do not get mixed up with all kinds of other brands of medicine. That's number one. And number two, maintain your critical thinking cap on and continue to make it. We want to make this better, not the same, better than the conventional medicine. So we want to really stick to the research, find out the evidence, and be fixated, be obsessed about it, because this is what's going to prove that it works. And over time, even cost is going to be cost effective, and it's going to show that it's better than allowing the suffering of billions, the loss of trillions of dollars, and then eventually getting to it. So it's the simplest path to happiness and health in the world. So I would say from an ideological point of view, just support that idea and stick to that.
Okay. When you talk about lifestyle medicine and its power, it's scientifically proven that it can prevent and treat chronic disease. What's your experience with reversing chronic disease?
From what I've read, from the scientific literature that I've read, it is very, very promising that lifestyle medicine may very well reverse chronic lifestyle-related disease. There are studies that show that it has, but who exactly? I mean, it's very important to measure our words. It doesn't heal everything. It doesn't, rewind every disease process, but the evidence is clear. It is the best and most sustainable way of reversing disease. Think of how many medications actually reverse the disease process. They improve symptoms. They can cut down risks of certain things, but how many do actually reverse the disease process at the cellular level? Very few, but if any. But lifestyle medicine can. Why? Because first of all, you're not introducing a medication. You're not doing a shortcut. I'm not anti-medication at all. I've prescribed medications thousands of times, and I've seen them save people's lives. But medication is a hack. If you think about it, it's like a physiological hack, right? Because we could not get the body to do what we wanted to do, you hack it, and it's a shortcut to try to get it to do something. And so lifestyle medicine doesn't use that. It uses what the body knows what to do with, meaning food and air and water and exercise and a balanced lifestyle. And then the body heals itself. So usually the repair is really down at the cellular level. I mean, things just start, if you let it do its thing. Diabetes has been shown to be reversible within lifestyle medicine, which is astounding. I mean, when I was in medical school, it was not considered reversible at all. I'm not saying that every diabetic is going to go back to it being normal, but I'm just saying that it's possible, right? Hypercholesterolemia, atherosclerosis, Dean Ornish has showed that atherosclerosis in the coronary arteries can actually improve with lifestyle changes. That's incredibly powerful.
Do you think we should, obviously, really minding the way we say it and the way we use the word reversal, do you think that we should talk more about that as a society and as a medical community? Because at the end of the day, if you don't see that as a possibility, then even the patient won't see it as a possibility. And I think that instills hope because it's really possible.
I agree with you. And furthermore, let's say it's not reversible. And let's say I'm not saying that lifestyle medicine cannot reverse a certain disease, but let's just say we don't have the evidence yet. What do you say to this client or patient? Well, we still want the best for them and the best quality of life for them. And if you can convince them that lifestyle medicine will provide them the best quality of life, I think that's a great argument. Now, the problem with that argument is that sometimes it's kind of like a abstract long-term idea. And they just really like their candy, or they really like to watch their TV today, and you're talking about like 20, 30 years from now. And so that's the challenge of coaching. You have to bring it home to them in a concrete way that they can understand. But ultimately, it's about quality of life. I spent 30 years of my life studying how life works and how to heal other people's health. And yet, I always think that health is just a tool for leading a completely fulfilling life and a happy life, and to help others, to improve the life of others, to love others. And so that is the purpose. And so in my experience, that's what I find is the hook. If you can get people to see that if they take part in lifestyle medicine, this is their best chance at getting to do what they want longer and better, like be with their grandchildren or do their job or enjoy art or travel, whatever it is they want to do, link that to these lifestyle changes. Notice that I'm not discussing really reversal of disease at the molecular level. I'm just saying your quality of life is going to improve in the long run. And usually that does it.
Who do you think are the cohort of patients who are more open to lifestyle changes in the chronic disease world?
Well, I am open to anybody. My practice is open to anybody. And yet, interestingly, I have about, I would say 85% of my clients are women in the age range from about 35 to 70. So they select themselves. By the way, another thing that I wanted to do when I left surgery was teach, because I love teaching. I've always loved teaching, and I discovered it during my residency. I was teaching medical students and I really enjoyed it. And I hated being rushed. So the other thing that I decided to do when I left surgery was I said, I'm going to start health coaching and I'm going to find the time to teach, right? I imagine myself as a professor or something in a college, but no, I've done it privately and I really find it very rewarding. What I find interesting is that even in tutoring, about 70, 80% of my students are women. I can't help but notice that pattern, that parallel. I suspect that men just don't like seeking out help. And when I have had men, especially as clients in health coaching, not so much teaching, they're difficult to give advice to. they don't like to hear things and sobering realities. And they oftentimes say or pretend that they've known it all along. There's a great saying in the coaching which says, one thing is knowing, but all that matters is doing. I mean, you can know everything, but if you don't do anything about it, there's no transformation. I think that's where men kind of straddle that. They know everything. They don't need to be lectured. Well, of course, yes, but they still don't do the right things. While women are much more pliable, much more likely, when they show up to me, they're already pre-screened themselves, right? That they're seeking help. They're much more ready and primed to say, hey, I need to do, not say or no, but I need to do something about my health, and they do it. And so I've had the best results with women. So that's a really interesting kind of sexist, but it's real,
Yeah. And I want to dig deeper in that because, people seldom do this comparison. But do you think that this has something to do with men being, again, we're generalizing here, but less likely to engage in emotional self-discovery and emotional sharing and emotional literacy in general?
Yeah, I think you're right, because you touch on another topic in lifestyle medicine, which is the emotions. I mean, one thing is behavior, one thing is habits, but why do we get ourselves into those habits and behaviors? And usually there is a very emotional and deep psychological reason for that. And so, yes, I agree. Great point that you bring up. I think women have more access to that aspect of themselves and willing to share with somebody else, right? Because everyone just struggles in their own person. But who's willing to come to somebody like me and discuss it openly? And, usually women. So yes, we're totally generalizing, but that's my experience, 80 to 20. So that's over 6 years or so. So yeah, it's an interesting pattern.
And I guess the deeper point here is that, tell us if you agree that your connection, your emotional connection with your patients has definitely been deeper than what you were used to before practicing coaching in lifestyle medicine. Because at the end of the day, you are really talking about emotions in your medical consultation.
In my medical or coaching consultation?
Or coaching consultation.
Yeah. Well, it's interesting that you say that because as I hinted at before, I would always kind of talk longer to my patients than the usual doctor, especially surgeon. I mean, there's studies that show that they usually talk like less than 7 minutes, and they're the ones doing the talking. So they're barely doing any listening. I had a client who said to me, I love my doctor. She's wonderful, but she carries a little timer on her belt. And at 7 minutes, she walks out, whether I'm in the middle of a sentence, I was never like that. And that was the part of medicine and surgery that I did not like, not having enough time. So it's a personality trait for me that I want to dig deeper. And this is where I find the most, a lot of the fulfillment of helping people. It was natural for me to spend more time and to get to know them deeper. So to answer your question, in surgery, I got to know my patients very well. Not as well as I wanted to, but really well. They would get to know me and we would chit chat and stuff, but it was very awkward and kind of outside of hours, if you will. While here, this is my job. And this is what I'm supposed to be doing. So I love it and I'm in my element. And yes, if you're a coach or considering coaching, You have to be ready to really get to know your clients and not say, oh, all this personal stuff. Well, no, that's exactly what we're doing. And by the way, we're not therapists, right? We're not therapists either. But in coaching, yeah, everything has to come out.
What would you say to a doctor, a health professional who's not very satisfied with his or her clinical outcomes with his or her patients and wants to do a shift, a change in their lives and in their profession?
So you said that they're not happy with their outcomes with their patients?
In terms of the chronic diseases that keep growing.
Yeah. I've met a lot of clinicians, doctors mainly, who are frustrated, who say, I can't bill for giving advice. So I just keep giving statin medications for cholesterol or whatever. And I keep telling them to lose weight and to eat better. And they keep coming back. And every time they come back, they're heavier and they don't seem to care. I'm just simplifying the story, but I mean, it's been a recurrent thing. And then after a while, as a clinician, this happened to me. As a clinician, you start getting, if you're not going to care about your health, then I'm not going to care about your health. So you start becoming cynical, right? And bitter, because here you're trying, you're working terrible hours to help somebody's life, and they don't even care enough to, that's what you're thinking. And so it becomes very nasty in that sense, because you need to love your job, I think. So to somebody like that, I would say, hey, lifestyle medicine is great, but there are going to be some challenges because, again, you can't bill for advice or for coaching right now, but things are changing. Things are improving. They're working towards that, towards creating codes so that you can say, hey, I coached this person on diet restriction for 20 minutes and here's my bill. I can't stand talking about money, by the way, because I like to focus on what's right and what's wrong and what we can do. But it comes down to that. It's terrible, but it comes down to that. Doctors know enough to be able to give the advice. They just have no time and they don't get the reward for it. And yet they have to pay the rent. So if they want to keep their lights on, they have to keep doing things the way they do. So it's a tough situation to be in. I would recommend to a doctor like that, say, study lifestyle medicine, maybe get the diploma if you like, come join the conferences, do all that, discover the field of lifestyle medicine, and then sneak it in wherever you can. And then what many doctors are doing is then they go hire a health coach that comes to their clinic, and then they say, speak to the coach about this, speak to the coach about that. And then they start getting real results. So there are doctors who don't want their patients on medications, but they just keep upping the dose because the patient's not doing anything else about it. But when they get a health coach or somebody like that, or maybe a nurse practitioner or a physician assistant who's trained in lifestyle medicine, then they start seeing the transformation, and then they shift the metrics of success. So instead of saying, whatever, you haven't died yet, great, and you're still giving you a prescription. Now it's like, hey, you lost pounds. Hey, your triglycerides are better. Hey, your blood pressure went down. And so I would love to work at a practice where everybody uses those numbers as their metrics for success. Then everybody in the team cheer honestly, sincerely, when a patient loses weight and they're basically moving away from getting a bypass, a heart attack, or a stroke. That would be a great place to work at and a great place to be a patient in. And so the beginning is to get educated, informed, to connect with others. And then even if you can't do it yourself, maybe you can get a health coach or a nurse practitioner to start doing that coaching component, following with them, educating them. And then every time you as the doctor see them, things are getting better.
I've heard you before talking about a minimalist lifestyle. Can you tell us about that?
Well, it's something that I kind of discovered by accident, because when I was living in Dublin, I was living in an apartment for 13 years. I loved it. It was great. I was a bachelor. But then my girlfriend moved in. Then we got married. We moved to London, and we moved into a tiny little apartment in Chelsea. Chelsea is extremely expensive, but it was a tiny apartment so I could walk to the hospital. And so I started downsizing. And then when we moved to the US, we downsized again, but with twins. And we just kept simplifying. I sold my car, and I gave up my TV about 13 years ago. I just kept giving away things and I kept finding that I was happier and happier and happier. Then when I got here, maybe 2012, 2013, I discovered that there was a movement in minimalism, but I had been doing it for probably 7 year before that. So I love the fact that there was a name to it. I'll tell you why that's relevant to this conversation, actually. I'm glad you bring it up because it's about mental health. And so I find it liberating that I don't have to worry about too many things. I have cousins and I have friends, with pools, with boats, with second homes. And the stress these things cause them is quite sad, while these things are just luxuries that are supposed to make you happy. So I try to keep things as simple as possible in my life, and I find that it helps my mental health. And so since then, I've been using that also with my clients. Whoever's interested, I start sharing resources and things and education about it. But I have had a client, for instance, have 2 big trucks for Goodwill and the Salvation Army come to her house and clear out stuff twice over. And she says, Victor, you have no idea the kind of weight that I feel off my shoulders, because I felt it was good stuff. And yet I felt guilty that I was not using it. And I knew that somebody else could be using it. And so it's like all of this emotional noise in your mind that she's been carrying for years. Now it's all gone, and it's going to be used by somebody who needs it. And she feels great. I mean, it's just incredible. So the principles of minimalism, just so people understand, it's not, to live. I mean, you can see, it's not like I live in a white room, right? So it's not about that. It's about basically understanding that the one true is time. Nothing else is non-renewable as time. And so I personally just want to make the most of my time on this planet. So the way I describe minimalism is intentional simplicity leading to clarity of purpose, which takes us to time and energy spent on the things that we care about.
Can you repeat that once more, please?
Sure. Intentional simplicity leading to clarity of purpose, yielding the time and energy to live a happy and fulfilling life. That's just like, I've tried to make it shorter, but that's kind of like the way I think of what it does for me. Minimalism just simplifies everything, cuts out all the noise, leading to clarity. So it makes things clear. My entire life, I believe in my dad and my mom taught me to have a healthy perspective in life. My eldest brother died when he was 5 years of age of an inborn liver problem. And I believe that shaped the way we were all raised, just appreciating life and health, and then doing something good with your life. I just wanted to have a clear purpose. And so when it simplifies everything and you have clarity of purpose, you know what you're meant to do, and which you have to discover yourself, then minimalism gives you the time and energy to do that and become happy. It's when people get crowd their minds with all the noise of celebrity and materialism and consumerism that they can never find what they're meant to do. And if you look at the classic, celebrity, child actor or something, they're miserable and they're drowning in riches, but nobody says no, nobody tells them their limits, and they just have everything they can have. We need to kind of reduce in order to simplify. And it's great because it gives you the freedom to own less and do more, experience more, be available to the people that you love. Yeah, it's fantastic. I sound like I'm lecturing or trying to convert anybody, but I would say explore it as a personal thing. And to my clients, I tell them when they are dealing with that, I point them in that direction. And by the way, coaching right now, sadly, is a bit of a luxury item. You don't see the average person with a coach. It's the kind of person that would have a personal trainer. Coaching clients tend to have some issue with materialism sometimes because they can afford it. And so it really does help them sometimes to see that the opposite is good for their mind and their health.
Before I ask my last question, is there anything like that you would like to share regarding what we've discussed today?
Well, I just think that we have to make sure that we don't get obsessed with our health. I've mentioned this to you before. The idea of becoming a health nut, it's a dangerous one. Again, it's the sort of problem that affluent people who get coaches can have. We can get self-absorbed in our health. I don't necessarily care much for health nuts because I find that they are self-absorbed and they don't do anybody any favors, and it can cause them anxiety because you can never be perfect and you can never control what you eat all the time and what's going on around you. So it causes a lot of anxiety and unhappiness. So I would say, remember that your health is an instrument for whatever else you want to do, your purpose. Don't just stop at, oh, look at me, I'm so healthy. Always ask for why do I want to be healthy? What am I going to accomplish with my health? And how am I going to impact the lives of others with me being around? That makes sense why you sleep well, why you drink, and why you take care of yourself, why you prioritize your health. Let's say as a mother, why should you prioritize yourself? There are mothers that run themselves into the ground for their children. Don't, because you need to be around for the rest of your life. So take care of yourself first to be. And so that selflessness requires thinking, what do I care about? Align it with your health, take care of your health.
What's next for you, and what's your dream for the next 10 years?
My dream for the next 10 years, I just mentioned kids. So our twins are now 9.5. So for the next 10 years, I just want to be around and prepare them to be happy, constructive, positive adults in this world that is so in need for people like that. Professionally, I am establishing an online health academy. Can hopefully, scale the impact that I can have on others by education of lifestyle medicine. And I'm always looking for innovators and people who just think outside the box for different projects. I was just commenting to you before. I love special projects. They keep things interesting for me. So I'm always looking to collaborate with people on health technology or print or textbooks or things like that. I love just whatever impacts people positively, I'm into. And that involves any kind of innovation.
Thank you so much, Victor. It was an amazing conversation. I think a lot of our audience got a lot of insights, and you left us with many things to keep reflecting about. I just want to thank you for your support, your mentorship, and also for being there in these initial moments of building a new movement in Mexico, and in sharing what you know and your experience, and most of all, your love for life, for health, and for family.
Thank you very much, Victor. And it's been a pleasure and an honor to be invited to your podcast. I can't wait to follow it and to subscribe. And I think Mexico is in the right time at the right place to be a leader in lifestyle medicine in Latin America and beyond. And I think it's perfectly primed to transform the health of everyone in the country. I'm looking forward to that.
Thank you. Have a nice day.
You're very welcome. Have a fantastic day.